Hello, my name is Dr. Chudi Godsons Fondu. Today we'll talk about an important topic in women's health. We'll talk about menstrual cycle. Excuse me. We'll talk about menstrual cycle. So menstrual cycle is very important to every woman. So please pay very close attention to the key points you need to know in menstrual cycle. So what's menstrual cycle? Menstrual cycle is the monthly series of changes that go on in a woman's body. And before you can actually start having menstrual cycle, you would have reached the age of viability in a woman. It actually starts when you have your puberty. So that's when you are actually likely to have a baby. That's your reproductive age. So menstrual cycle are those series of changes that happen to every woman's body in preparation for possibility of having a baby. So the way the body of a woman is designed in such a way that every month your body is primed as if it's gonna have a baby. That's the natural process. So each month, one of the ovaries will release an egg. Remember, we have two ovaries. So there are a couple of organs in the body that have two options. So we have two ovaries. So the reason why we have some of the structures in the body double is to compensate if anything happens to the other. So in the body, you have two ovaries. So every month, one of the ovaries will prime one of the eggs. Remember, the eggs are contained in the follicles. So one of those eggs will be primed to be released. The release of this egg is what we popularly known as ovulation. And there are a couple of hormones that play a role in this process. So many key hormones that will definitely help to make sure you have regularity, that you perform these basic roles. We have a particular hormone we call FSH, follicular stimulating hormone. Then we have the luteinizing hormone. We have estrogen, we have progesterone. There are a couple of other hormones that actually play a role in the body of a woman, but the ones I mentioned are the key hormones that play a role in menstrual cycle. So when those eggs are released, if the eggs are fertilized by a viable sperm, the process of fertilization will continue, which will lead to the definitive phases that will end up in production of a new baby. But if after ovulation, the eggs or the egg, because you can actually have release of more than one egg, which is the process that will lead to twin pregnancy or multiple pregnancies. But if the egg or the eggs are not fertilized, over time the lining of the womb will start to shade. And when this happens, that's exactly what leads to your monthly period. That's what it's called, the monthly period. So you can see key important aspects of the menstrual cycle. So the release of the egg, which is called the ovulation. Then when the released egg is not fertilized, the lining of the womb will start disintegrating. That's actually what happens in the monthly release of blood. That's slowing off and removal of the lining that covers your womb in preparation of pregnancy. That's what happens when you have your monthly period. So why is the knowledge of menstrual cycle important? First of all, your menstrual cycle is unique to you. So your own menstrual cycle might be entirely different from another person's menstrual cycle, even if you guys are identical twins. So it's unique to you. And when you're able to track your menstrual cycle, it can help you to understand what's normal for you. When you know what's normal for you, you can actually know what's abnormal. And it can also help you to know exactly what your menstrual cycle is. It can help you to know when your ovulation period will likely be. It can also help you to know when you're fertile and when you're not fertile. And when you know when your fertility window is, you can either plan to become pregnant or you can plan to avoid pregnancy. So when you know your menstrual period, when you know your menstrual cycle, is going to help you to decide all these things I've mentioned. Also, the knowledge of your menstrual cycle will help you to identify important changes. The body of a woman can actually change, and any change in the body of a woman will indicate that something is about to happen. So changes like missed period, or if you have intermenstrual bleeding, or if you have unpredictable bleeding apart from the one you know already, it might be a sign that something is going on. You need to report to your doctor. So what's normal and what's abnormal in a woman's menstrual cycle? So in this regards, normality is actually a very loose term, because what might be normal to you might not be normal to the other person. But generally, we normally use 28-day cycle. So a cycle is actually calculated from the very first day you bleed until the other day you will bleed in another month. So let's say you bled in January 1st. If you start counting on that 1st of January you had your bleeding until you bleed again in February, that's your cycle. It can be 28, it can be 26, it can be 27, it can be 29. The normal range for this, when I say normal, is the one that it's commoner. It's either 20 to 35 days, and normally it can last for 2 to 7 days. But remember, what might be normal for you might be abnormal for the other person. So the range of 21 to 35 days is actually what is normally identified as normal. So anything outside this window can actually be a sign that you don't have a normal period. So if you have less than 21 days, or if you have more than 35 days, then you have a need to see your provider to make sure things are okay. Normally, if a lady starts having her menstrual bleeding at the onset, it can stretch, but it can have a longer period. But the older you get, the more regular it becomes shortened. So if you have a little daughter that recently started having her menstrual bleeding, you will discover that it may actually not be predictable. It can actually be long, it can be irregular, but the older they become, you will notice a kind of irregularity. Then towards the end of your reproductive life, which is menopause, it can also go on irregular pattern. It can, be long, it can be short, but whatever happens, your menstrual cycle might be regular. By mean regular, it might actually come about the same time every month, or it can be irregular. Also, it can be pain-free, or some people can have painful menstrual period. Some people can have short, some people can have long. Whether you have pain, long, short, it can be your regular. But if in the past you normally have pain-free period and suddenly you're having a painful period, or it's very heavy when previously you used to have light period, then it might be a sign that something is going on. So that's why you need to know the normal, so you can know when the abnormal sets in. So keep in mind that there are certain conditions that can alter your menstrual cycle. Use of pills and use of some other contraceptives like IUCD can alter your menstrual cycle. It can change the flow, it can make it to be light or heavy, or you can completely not even experience it sometime. Please be very mindful if you're tending towards your menopause and suddenly you start having irregular bleeding, or what we call dysfunctional uterine bleeding. Please reach out to your provider, because at this stage, at this period of your life, we're very careful to make sure we pick any cancers that might be, lurking around the neighborhood. So be very mindful. So how do you track your menstrual period? Like I mentioned, start keeping records. So start from the very first day you experience the bleeding until you experience bleeding in another month. That's how you track it. Try and keep a diary. If for any reasons you notice that maybe there's some irregularity in your period, please, you can keep the end dates so you can know how long each period typically lasts. So if you know how long or short it is, you can now use it to know if subsequent ones fall into the same category. You can also record the flow. Is it very heavy? Is it light? So if you normally have a heavy period and suddenly it's light, it's something you might want to discuss with your provider. Also, you have to know how often you have these changes or how many sanitary protection or pads you normally change. Did it increase suddenly or did it just reduce? Or do you normally pass blood clots or suddenly you notice that you're passing blood clots? Also, keep an eye on abnormal bleeding, intermenstrual bleeding. So if you normally bleed every 28 days and suddenly you notice that you bleed more than you should, it's an indication you need to see your provider to make sure everything is okay. So if for any reasons you notice any change in your body, maybe you notice some mood changes or your behavior or you're suddenly not happy, it's possible your hormones are playing tricks on you. So if anything changes, please make sure you discuss with your provider. So what are the likely things that can lead to irregular menstrual cycle? What are the likely things that can lead to irregularities in menstrual cycle? So it can be due to pregnancy. Pregnancy can change it. It can be due to breastfeeding. It can be due to eating disorders. So if you have some conditions like anorexia nervosa or bulimia, these are eating disorders. It can actually affect your menstrual cycle. If you engage in extreme sports, it can also affect your menstrual cycle. Also, if you have what we call polycystic ovarian syndrome, it can affect your menstrual cycle. If you have what we call premature ovarian failure, which can lead to early onset of menopause in some women, this can also affect your menstrual cycle. If you have any infection whatsoever, especially the ones we call pelvic inflammatory disease, or you have uterine fibroids, these are all factors that can alter your menstrual cycle. For example, some women that have fibroids might actually start experiencing what we call dysmenorrhea. So you start having very painful period, or you start having very heavy bleeding, or you start having longer bleeding. So these are the things you should be conversant with in regards to your health. It's very important. Your menstrual cycle tells a whole lot about your overall women health. So please take time, get a diary, keep a track of the changes. If you have a young girl at home that recently started experiencing her menstrual bleeding, please help her to keep diaries because the earlier she can track the normal, the better to know when things go abnormal. Okay, so that's what I have for us this evening, and thank you for watching. Bye bye, and have a good evening. Bye bye.